Good morning. At the outset, my sincere apologies for not being able to be present physically at this wonderful conference. I thank Dr. Sudhir Shah for inviting me to share with you what I think is going to happen in just 15 to 20 years from now. Futurology is a pseudoscience in which I have been interested for several decades. This is the ability to forecast the future on a systematic basis by studying the study of present day trends in human affairs, extrapolating what happens in cutting edge technologies today. Before I go into healthcare, particularly into neurosciences, let's spend a few minutes deciding or rather seeing how the world is going to be 20 years from now. Continued economic growth with 1.5 billion people in India. There will be pressure on energy, food, and water resources. New technologies will be adopted instantaneously with no adoption lag. A new continent, so to say, called Chindia, which is a combination of China and India, will be the superpowers of the world. The United States and Europe would have lost their scientific and technological supremacy. Unfortunately, 3 out of 8 billion people may still have no drinking water. You can see how I have transposed the world, the globe as it were, on the human brain. This is to show to us that it is the brain and the functions of the brain alone which is going to decide on how the world is going to be. I vaguely remember when I was just 5 years old, almost 65 years ago, seeing a train with hundreds of people traveling, not on the inside of the train, but on the outside of the train. I am absolutely confident that before I leave the world, I will see India as shown on the slide on the right. Super skyscrapers, 150-story buildings will be the order of the day. The country which only had a past is beginning to be seen as a country with a future. US intelligence have predicted that by 2030, India will be a rising economic power. We are going to be in the forefront of the deployment of 5G. We are going to talk of phablets, not tablets and phones. We will be the global leader in the delivery of IT-enabled services and certainly the most connected IT-savvy society. How is the world going to be? Prepare yourself for a revolution. Organ transplant probably will recede into the background, and I foresee that 3D printers will be used in India to create fully functional organs. Preliminary work has already started on this. We will no longer talk of supercomputers. Google a few days ago announced the successful deployment of quantum computing chips. Quantum computing chips will be able to do in 150 seconds what took 10,000 days for a supercomputer to do. Again, flying cars. My grandson are absolutely confident that they will be using flying cars, and I have no reason to disbelieve them. This is the world which is going to happen. Healthcare will totally be changed to what I would like to call P4 medicine. When I was a medical student, a postgraduate, an assistant professor, and a professor, we were taught to diagnose and treat. My students will talk about participatory medicine, preventive medicine, predictive medicine, and most important, personalized medicine. The genomic analysis will tell us precisely how I, as an individual, am going to metabolize a particular drug which is given to me. Drugs will be customized, personalized, made to order, so it were, based on my genomic studies. Personalized medicine will be the order of the day. The core function of the brain is information processing, decision making, and executing the actions. The brain, ladies and gentlemen, is a general information processing framework that has the capacity to derive predictions and decisions. Functional domains are specialized nodes of this framework. A deeper understanding of the brain will enable us to go into what we would like to call brain-inspired artificial general intelligence. I personally don't like the word AI. I don't think there is anything artificial about it. It is nothing but an augmentation, an extension of the natural native intelligence purely based on how the brain works. We are all familiar with the deployment of AI in healthcare, but at the moment, this is used for ultra focused studies. For example, seeing how patterns exist in diabetic retinopathy and coming to a diagnosis, analyzing images and patterns in a chest x-ray and making a diagnosis which is as good or even better than that made by an experienced radiologist. But what the future holds in store for us is artificial general intelligence, which is going to be much more difficult than deployment of AI in these very highly specialized focus. We all know Mark Zuckerberg, the inventor of the Facebook. Zuckerberg says that brain reading wearables are not in the distant future, but certain functions may actually require implanted devices. Articles have already started appearing in scientific journals, including Nature, on how wearables will eventually be able to track the signals emanating not just in the brain but in the spinal cord. We all know that when I want to move my hand, the hand moves because my brain orders a particular muscle to contract and another to relax. If I am able to identify the electrical basis of this, I can simulate this, and this is what is going to happen in the very near future. Cutting edge technology already has shown that in the laboratory there is a possibility of wearing wearables like this which will actually execute motor movements. Of course, there's a long gestation time, what we call from the laboratory, from the bench to the bedside, but this is definitely going to happen. Can you imagine this being a day-to-day occurrence in almost every laboratory, in every hospital in this country? Far-fetched, but not impossible. A robot drawing blood, a robot being a phlebotomist, a robot will be able to identify the vein, put in a needle, take out the blood, and send this blood to the laboratory for whatever test you want. On the top left-hand side, you see images, you see thermal imagery, you see how the robot can find out where exactly the vein is. At the moment, it's very cumbersome and certainly may not replace human phlebotomists, but it's just a question of time because these get miniaturized. I would never have dreamt, even a couple of years ago, that fecal matter, a waste product which all of us detest, can actually perhaps be used in the management of many disorders. Clinical trials will shortly begin on fecal transplants, whether it can reduce symptoms of autism in the long term. Department of Biotechnology, Government of India is funding projects on analyzing the microbiome in the management of diabetes mellitus type 2. The way the fecal organisms are distributed in the fecal matter is going to give us considerable information of the effect of the nervous system on the gastrointestinal tract. About 15 months ago, I wrote an article on artificial intelligence in neurosciences. This was purely a clinical article, a clinician's perspective on how exactly artificial neural networks, machine learning, deep learning, and so on can be deployed in day-to-day clinical practice. I was really astonished that several thousand of this article has been downloaded more than 7,000 times in just 15 months. This shows that the clinical community is certainly thirsting for knowledge on the use of AI in healthcare. Harvard Business Review, we all know, is one of the world's most recognized journals in the field of business care. Articles on neuromarketing in Harvard Business Review show how brain scans will eventually help companies sell more. Neuromarketing has now been recognized as a subspecialty, and this course is offered by many IIMs even in India. What exactly is neuromarketing? Neuromarketing tools used, as you can see in this slide, can be sophisticated technology like positron emission tomography, functional MRI, steady state topography, facial electromyography, etc. etc. What does this mean? This clearly describes what actually happens in the brain, both from a sensory modality and from a motor output when you see an advertisement. Which part of the brain is stimulated? More important, which part of the brain is responsible for the motor reaction of my taking up an app and placing an order for a pizza or buying a ticket to see a movie? This is what neuromarketing is all about. Today, giant multinational companies are employing professors of neurophysiology at an astronomical salary to find out how eventually neuromarketing can be used to get inside the brain of potential customers and activate impulses in the brain of these potential customers in order to increase your sales. It is not science fiction. This is going to happen very soon. Brain-machine interface. This activities on this BMI have been going on for the last 10 to 15 years. However, the progress in the last 1 year has been phenomenal, and soon the distinction between activities of the human brain and activities started by a brain, executed by a machine, is going to be less and less. We all know about Elon Musk. We all know about Tesla battery cars. We know that Elon Musk is a multi-billionaire who is already making plans to send astronauts for colonization in Mars, not just on the moon. Elon Musk is investing billions of dollars in order to have a module that sits outside the human head, which will receive information from threads embedded in the brain. You can see laboratory work research has advanced tremendously, and it is expected that very soon, within the next 1 year, initial clinical trials will happen. We will be implanting electrodes, as you can see, less than the thickness of a single strand of human hair. This fully implantable neural interface will, through radio telemetry, connect to a small cute little device which can be put behind the ear, and by initiating a thought process, you will be able to convert the thought process into a motor reaction. Articles have been published in the AANS, American Academy of Neurosurgeons, how demonstrating in trials in the laboratory environment how one man can control another human being's motor activity in the first human brain-to-brain interface across the internet. Sitting in Madras, it is possible for me, not theoretically, but practically, assuming I have a very, let's say a 1 Gbps bandwidth available to me, it is possible for me today to make Dr. Sudhir Shah's left hand move at my volition, provided he and I are wearing the same headgear band. Imagine what is going to happen in the next 10 years when research on this progresses further and further. All of you are aware of deep brain stimulation. Today, DBS has become available in at least 30 to 40 centers in India for the management of Parkinsonism, involuntary movements, and a few other limited conditions. Perhaps in the years to come, we will be using DBS, that is, identifying specific clusters of neurons in the brain. Let's say the satiety center, the feeding center, which is responsible for the obesity. Management of obesity will not only be by altering lifestyle, but by destroying selectively specific areas in the brain. And imagine the commercial potential if DBS can be used in the management of hypertension, in the management of diabetes. Could I ever have imagined that a neurosurgeon would be maybe the secondary or tertiary consultant in the management of diabetes, hypertension, and so on? As a postgraduate in neurosurgery, I was taught that the management of Parkinsonism, movement disorders, and several other neurological conditions involves a tremendously in-depth study of neurotransmitters and how neurotransmitters need to be augmented either medically or electrophysiologically or by destroying certain parts of the brain. Out of the box thinking today has resulted in biomedical engineers taking over, so to say, the management of several neurological conditions. Devices to control tremors. Here is a lady with an essential tremor who had failed with many neurosurgical management, and a biomedical engineer has made a special gloves, and using these special gloves you can see this lady is able to sign, able to drink a glass of milk, which was never ever able to do all these years. So beware, biomedical engineers are going to take over and neurologists will have to go to the back seat. Neurogenetics. The question of ethics arises. We already have 90% of the medical genome analyzed, and this is available clinically in at least 10 to 15 quaternary care centers in India. The day is not far off when with 2 ml of blood, I may be able to predict whether 20 years from now you are going to have an increased risk of developing Alzheimer's, Huntington's chorea, cancer, breast, gastrointestinal tumors, and so on. More important than that, we are now talking of damaged goods. We are talking of genetic haves and genetic have-nots. Will insurance companies agree to insure people when they know that they can predict what is going to happen 10, 15 years from now? Unfortunately, in the real world, what is going to happen is your economic status will determine biological differences, not at present, but even in the future. Neuroethics. Traditionally, ethics has been relatively simple, but today we talk of neuroethics, and in neuroethics, a court may order central nervous system interventions, no freedom to think one's own thoughts. It is possible, and this has been demonstrated several years ago in a Spanish arena, bullfighting. An electrode was implanted into the amygdala in a charging bull, and a neurophysiologist, I even remember his name, Delgado, with a radio transmitter was in front of the bull. He was so confident that he could stop the charging bull, and this is exactly what he did. So this is going to be the future. The neurosurgeon will not diagnose and treat brain tumors. He will be a quality of life consultant. A new field called augmentative neurology is going to develop. People are not satisfied, are not going to be satisfied with an IQ of 110 and 120. They would like to be geniuses. And once we know exactly why somebody is super intelligent, it's a question of time before we will be able to simulate or duplicate this. Neurointervention to stop cigarette smoking, to stop drinking. Why do you need to buy a tablet Viagra to empower your sexual enhancement capabilities when you can do this by putting an electrode into the nucleus accumbens septi? Soldiers of the future are going to be neurologically enhanced. They are going to think faster, they are going to run faster, and augmentation is going to be the name of the game. Cosmetic neurology. We are not going to talk of botulinum to remove your creases on your face. We are going to talk of cosmetic neurology to ensure that you remain young for a very, very long time. Almost a year ago, the FDA has already approved mHealth applications using AI software to analyze a CT scan for an impending stroke without human intervention. Imagine a portable mobile CT scan being taken at the patient's house, the pictures being sent to an app, and the app decides whether thrombolysis is to be initiated or not. This has already started clinical trials, and it's just a question of time before this becomes a part of every neurologist's armamentarium. Interventional neuroradiology has taken tremendous strides, and I'm very happy that Gujarat, in a few 20-30 miles away from Ahmedabad, if I remember right, a cardiologist has already started the first telecardio angioplasty procedure being done. This is going to become even more sophisticated. Robotic threads are going to be introduced into branches, arterioles, not into the middle cerebral artery or the anterior cerebral artery, but into small branches. This will be seen in the image as you can see on the right, and we will be able to do interventional neuroradiology of a type unheard of at the present moment. The world's first 5G powered remote brain surgery was successfully performed in China several months ago. The availability of 5G, it may take 2 years, 3 years, maybe 5 years, but nevertheless, in 5 years, once 5G becomes standard available in every hospital with every doctor, we are going to look at healthcare in a way we never ever dreamed possible even today. As a staunch nationalist, I am delighted that Niti Aayog has already identified artificial intelligence in healthcare as a major area to which importance has to be given. A national strategy for AI development has already been brought out as a white paper, and I think that India will never be far behind any other country for the use of AI. We are not going to piggyback, we are not even going to leapfrog. After all, how much can a frog leap? We are going to pole vault, and I foresee that in 10 years from now, the deployment of AI in healthcare, India will be the leader compared to most other countries. Ladies and gentlemen, we need to be future ready. Ahmedabad is the birthplace, one of the major centers of the Indian Space Research Organization, particularly for the use of societal applications. As an Indian citizen, I am delighted that ISRO, in just 21 months from now, will be sending India's first 3 Vymanauts into low Earth orbit. Just to show that we are future ready, Neurology India, the world's 4th leading global journal in neurosciences, a couple of months ago brought out a special edition exclusively devoted to extraterrestrial neurosciences. What is going to happen to humans when they travel outside the Earth? And in 10-15 years from now, India hopefully will be having its own satellite stations orbiting. We will be sending our first mission to man, and who knows, maybe in 20 or 30 years, even a mission to Mars. Coming back to the real world, these are the spin-offs of space technology. One of the innovative methods in the use of avoiding or reducing the impact of two-wheeler accidents is deployment of airbag. These are all extremely simple. You can see what happens here. In spite of wearing a helmet, it is quite possible that accidents take place. Today, an airbag could theoretically be available at a very low cost, and when there is a high impact, the airbag may help reduce the intensity of the accident. Ladies and gentlemen, I could go on and on, but then I understand that time is a constraint. What is my take-home message? My take-home message is that technology should never ever be the dominant part. It is we, a fool with a tool is still a fool. Technology is only a means to achieve an end. The good physician treats the disease. The great physician treats the patient who has the disease. My teachers taught me not only to treat the patient with the disease, but primarily to treat the family where one of its members is a patient who has a disease. Medicine will continue to be a science of uncertainty and an art of probability. Listen, listen, listen. The patient is telling you the diagnosis. One wonders how Sir William Osler, the author of the above statements, would have reacted to the phenomenal advances in healthcare today. For centuries, for millennia, the essence of practicing healthcare has been a physician obtaining as much data about the patient's health or disease as possible and taking decisions. Today, artificial neural networks, machine learning, deep learning all claim that they will be able to get this information in a fraction of a second. Time and time alone will tell if advances in healthcare will be a bane or a boon. Most of us are afraid of the future. We cling desperately to the present, not realizing that we have already become the past. As Mark Twain once remarked, the future ain't what it used to be. Remember that the future is not going to happen day after tomorrow, not even tomorrow, not even today. The future is going to happen yesterday. And unless we are future ready, we will continue to be members of the Jurassic Park. You can ignore reality, but you cannot ignore the consequences of ignoring reality. The nicest thing about the future is that it always starts tomorrow. I totally disagree with this statement. The world has shown time and again, particularly in the last 5 years, that the future does not start tomorrow. The future is always ahead of schedule. Thank you once again for inviting me. I wish I could physically have been here, but where the mind and the heart is, there is your true existence. And my virtual presence there is giving me as much satisfaction as my physical presence. Thank you, Dr. Sudhir Shah and the organizers for inviting me once again.